Good afternoon, Professor. My name is Nicola Kears. I am doing Unit 10 journal. So the first question says, what goals did I set for myself at the beginning of the semester, and did I meet these? So I had several goals. Identifying proper diagnosis codes and when to use them, documenting and charting appropriately, time management with charting and sessions with patients, and being confident during my interview, mastering the different therapeutic modalities. Most commonly used CBT was the most, and let me see if I place this here, if I can. I took some notes here. So yes, my goals were definitely met in all areas. Let me dive into understanding the diagnosis codes, and then also like learning when I have a patient in front of me and when to kind of guide them in the interview process, and taking control of the session so it doesn't continue to go on, because obviously I have a list of patients that I need to see, and there's only so many hours in the day to ensure that the patients are properly seen, the charting is completed, and they are satisfied. So yes, all the goals were met. I did learn a lot about the diagnosis codes, how to use them, also like different medications, the purposes, and how to be confident doing the interview and sessions with the patient, and really understanding the patient and being able to provide proper feedback and tools to assist the patient. What feelings, prejudices, and biases did I experience during my clinical experience, and how did I manage them? So the clinical setting was the PHP program, which treats, it's dual diagnosis for substance abuse as well as the mental health component. So we had some patients, mothers that struggled with substance use, some that just can't stay sober, and the provider feels the benefits outweigh the risks to keep the patient on Suboxone. And I have my personal beliefs in terms of a patient staying on Suboxone, whether they are pregnant or just being a mother in general, and feeling that the abstinence route would be best for them. But I have to look at the whole picture and understand the benefits versus risk, and understanding that. So that was the main feeling that I had to overcome during the clinical. Let's see. So how did I manage my anxiety, self-doubt, and uncertainty? So I am an anxious person at my baseline, hence why I furthered my education into mental health. And I think I just overanalyze everything, overprocess my conversations, and really continuing to practice via the Oculus as well as the repetitive interviewing process, watching my preceptor, and then actually applying the practicing with myself really helped me with my anxiety and self-doubt and the uncertainty. And I think just repetition, the more I do it, the less I will feel anxious and the more comfortable I'll feel in doing this. What understanding or insights did I develop during my clinical experience? So I guess the better understanding, like I said, of the medication uses, how to treat a patient that's struggling with mood disorder, anxiety, depression, substance use, psychosis, and how to provide the proper therapeutic approach as well as the medication component to that. How has reflective practice impacted me as a person, student, and or provider? If so, how? So reflective practice has impacted me as a whole. I think it has bettered me professionally and personally. Just understanding and practicing it has definitely provided a better patient outcome. Will I continue to use the reflection in my future practice? If so, why and how? So I'll certainly use that in my future practice, as I think it enhances the patient, the client and patient outcome. It's beneficial for me as a practitioner, as well as a human being, to provide the best care, whether it is with the provider and the patient, as well as just relationships as a whole, with personal relationships or professional relationships, and the patient clinician relationship. And it's definitely beneficial to practice that.